We know that there's many in the public that have the question of, when can I get vaccinated, and where do I go to get vaccinated? When is my turn? To help with that, we have placed on the coronavirus.idaho.gov website an estimated timeline that lists out the various groups that have been proposed at the national level and are being discussed here at the state level, with our best estimate of when vaccine might start for those groups. And that may change as we get more information. There's a lot of assumptions in there, but that's our best information right now, and the best place for individuals to go to answer that question, when can I get vaccinated? The next question that the consumers have, or the public have, is, well, where can I get vaccinated? And that's going to be a little bit different for each priority group, but the short answer is really the normal places that you would go to get vaccinated, whether that's your doctor's office or your pharmacy. We'll be also looking at employer clinics, especially for those critical infrastructure jobs. That's essentially what's happening in the hospitals now, is we're doing them at the employer. Local public health districts will be offering vaccinations in local pharmacies. And so the answer to the question of where am I going to get vaccinated in its simplest form is at the usual place that you would go to get vaccinated. As of today, there have been 20,843 vaccines administered over the last 3 weeks and just a few days. This has definitely been a startup process for administering these new vaccines, as I just mentioned, and we've seen an increase in the number of vaccines administered each week, with an increase of 43% in from week one to week 2, and an additional 30% increase in week 3 from week 2. Those increases happened in weeks that were essentially 4-day weeks with Christmas and New Year's, and we expect that number of doses administered to continue to increase. I wanted to mention that Idaho's allocation of doses is being shipped directly to enrolled healthcare providers and local public health districts. And we've actually activated the Federal Pharmacy Partnership for Long-Term Care Program. What this is a partnership at the federal level with Walgreens and CVS to vaccinate staff and residents at long-term care programs. To activate this, we had to divert some of our allocation of doses to that program and take a couple of weeks to get enough built up to start the program. And those vaccinations started on Monday, December 28th, just a little over a week ago. We anticipate that over the course of this partnership, we'll transfer 33,150 doses over to Walgreens and CVS to immunize staff and residents at long-term care facilities. Finally, I just wanted to emphasize that it's this still remains extremely important that we all wear a mask, that we maintain 6 feet of distance between non-household members, and wash our hands frequently. Those items have been used quite effectively over the last couple of weeks, and we're seeing a positive trend in our numbers. We're not out of the woods, but a positive trend in our numbers. And particularly as we get ready to go through the vaccination effort, it's more critical than ever that we follow those simple precautions.